Okay, so now we've talked about the PA procedure, how it's done, how it works, what to expect immediately after the procedure. But now it's time to talk about the long-term results of the procedure, which I think is probably the most important part of the conversation. Um, Whenever you're talking to someone about the PA procedure, it's fine for them to discuss, kind of what the scientific literature shows, what the results are published in, all these journals. But you should really ask them, how many procedures have they done and what are their individual results? I like to tell patients, I've done hundreds and hundreds of these procedures now over the years, over a decade. When I tell patients what the results are, I'm telling them about my results, what a patient will experience if I do the procedure, not just kind of what the literature shows. And I think that's a really important, really valuable, and really powerful to say, hey, here's a paper I published on how it works for urinary symptoms, or how it works for getting your catheter removed, or how it works for getting the blood out of your urine. And so those actually publications are all available on my website for you to download if you like. For patients who have lower urinary tract symptoms, we can expect about a 2/3 reduction in their symptom score, that International Prostate Symptom Score, getting them back into the mild range typically. Overall, we'll get patients off of their BPH medications about 60% of the time. For patients who have those long-term indwelling catheters, we'll usually get them free of the catheter and back to a sustainable, reasonable urination pattern about 3/4 of the time, 75% of the time. For patients who have bleeding in the urine as a result of their prostate, we'll usually get the bleeding stopped well over 95% of the time. For those patients who don't get kind of result with the bleeding, it's usually because they're on a blood thinner, like a patient's had a stroke or heart attack. Now, when you look at the long-term results, we've kind of seen these results sustained over about a 5-year period. And just now we're getting enough patients, enough data to kind of look at the longer-term outcomes beyond 5 years. When you look at most BPH procedures, and even most people most centers who've done PAE procedures, you'll usually see about a 15 to 20% need to kind of reoperate or do another procedure somewhere in the 5 to 10 year mark. Now, some of those have undergone repeat embolization. I've done really not that many of those. And then another group, about maybe half of those patients undergo some other procedure because they decide PA wasn't, for them, it didn't work for them. But those are the overall kind of long-term data. And now we're seeing more between, longer than 5 years, we're seeing that kind of pretty low recurrence rate of symptoms afterwards. And I think it has to do with, one, the kind of embolic agent we've used over time. We've typically used the smaller size beads, the 1 to 300 beads, and more lately we've been using the glue, which some other centers have published really excellent data on. And it also has to do with kind of the time and the effort and the skill one brings to the table to really sit there during the procedure and really map out all the vessels and really go after any little vessel that might be feeding blood flow to the prostate, to really try and get a patient as complete a benefit as possible, to really kind of treat the gland as completely as we possibly can.